Hello.
Hi, AJ.
Hi.
I'm Shane. I'm your nurse today.
Awesome.
AJ, can I get your last name, please?
McMullen,
And your birthday?
11/08/93.
And you're young. Alright. Can you tell me today's date?
May 20. The date?
Yeah.
May 22nd.
Perfect. Do you know where you are?
I'm at your house.
Perfect. Do you know what's happening?
Yeah, you're gonna assess me.
Perfect. So I'm gonna wash my hands. I'm gonna provide privacy. I'll pull the curtain, close the door. Let's see here. Overall appearance, AJ looks to be in good health. A little bit fuller than usual. Looks like we got some tetany going on in his pectoris muscles.
Yeah, what's up?
But overall, AJ looks to be in good health. So the purpose of this video is we're going to be doing a head-to-toe assessment. We're going to be focusing on the head to neck region. So let's get into it. So like I said, we're going to get into it. AJ seems to be in good health. Looks like he is alert and oriented to his place, surroundings, and what we're doing. His affect is clear. I can understand him pretty well, minus his slight Midwest accent. His perception is normal. He knows where he is. So let's see here. So AJ, start off with, I'm just gonna kind of look over your general appearance. I'm gonna kind of look at your hair. Looks like his hair is normal, kind of thinning a little bit, but that's okay. Same boat here.
It's a hate session.
Yeah. I'm gonna take a look at your hands here. So right now I'm assessing his fingernails. Nothing abnormal with his fingernails. I'm gonna check his capillary refill. Less than 3 seconds. Skin turgor. No tinting, so that's concurrent with him being hydrated. I don't see any edema in his upper extremities, which is good. No clubbing of the fingernails or nails in general. I'm gonna move on. Okay. So I'm gonna assess AJ's cranial nerves. Looks like I'm gonna be assessing cranial nerves 1 through 12 for this video. Purpose of this assessment, I will be assessing unilaterally, but in the future, for patients, I will assess bilaterally. So the first cranial nerve I will be assessing is the olfactory nerve. So I have here a cotton tip applicator. I'm gonna have AJ plug one side of his nose, and I'm gonna see if he can give me the smell of it.
Is it there?
It's there.
Coffee.
All right, perfect. So that is indeed indicative that the olfactory is intact. So I'm gonna take my little otoscope. I'm gonna check his nostrils. The turbinates appear normal, so we're good there.
That's a nice little thing.
So we're going to continue on to the second cranial nerve, which is the optic nerve. I am going to assess AJ's pupil reaction. I'm going to do his right eye. AJ recently had LASIK surgery done on his left eye, so we're going to do the right side for this. So go ahead and look forward for me. There we go. So we do have an active perla. Perla is pupils are equal, reactive, round, and reactive to light and have accommodation. Pupils were about 3 to 4 centimeters, but they dilated around to 2 centimeters once I applied the light. Let's see here. We're going to continue on to the ocular motor, trochlear, and abductin. So AJ cover his left eye, since we're focusing on the right eye. I am going to have him look at my pen here, then I'm going to have him uncover his eye and look. So let's do it one more time. So I had a positive reaction with his eyes there, focusing no strabismus. Strabismus?
Yeah.
So close
Sounds
enough.
good.
For the next test, I'm gonna test AJ's 6 fields of gaze. So I'm gonna have him watch my pen here. We're gonna go to the right, left, and back, up, right. So 6 field of gaze seems to be intact for AJ, which is good news. Next, we're gonna continue on to the trigeminal nerve. So I'm gonna set this down. Does that clench your jaw? Is that what it says? Well, I have you clench your jaw, AJ. Move it side to side. Perfect. Any clicking, pain?
No.
Perfect. Good deal. Can I have you close your eyes for me? I'm going to have you identify where the Q-tip is.
My left cheek.
Okay.
Right forehead. Right cheek.
All right, perfect. So that seems to be intact there. Next, we're going to continue onward. Since we already assessed the cranial nerve 6, we're going to go to the cranial nerve 7, which is the facial nerve. AJ, if I can have you smile for me. Perfect. Let's see here. Puff your cheeks out. Squint your eyes. Not all at the same time. Can you make your lines and your creases on your forehead like you're frowning? I don't know. There we go. Perfect. That was
a weird one.
So the next cranial nerve I'm going to be assessing is cranial nerve 8, the vestibular cochlear nerve. For that, I'm going to have AJ plug his right ear. I'm going to perform the whisper test. This is to test and see if AJ is able to hear out of his left ear. Probably won't be based on what his wife tells me. So I'm gonna whisper three things. Three things to AJ, and he's gonna repeat them back to me. Red, blue, white.
Red, white, and blue. Red, blue, and white.
Yep. Okay. Got a little mixed up there, but overall he did well. So the cranial nerve 8 is intact. So we're going to continue on to cranial nerve 9 and cranial nerve 10. Cranial nerve 9 is the glossopharyngeal. Cranial nerve 10 is the vagus nerve. For this, I would assess for AJ's gag reflex for the purpose of this video. We will not do that.
Don't have one anyways.
Probably not. But I'm going to have AJ open his mouth and say "aw" for me. You say "aw." So I'm assessing the uvula. The uvula is midline. It does rise and fall when he says "aw," so that is a positive indication of the vagus of cranial nerve 9 and 10 are intact. Excuse me. Let's see here. I'm going to say "aw" for me again. I do not see any tonsils in the back of his throat, so it looks like we're going to move on from there. Next, we're going to be assessing cranial nerve 11, which is the accessory muscle, the accessory nerve, excuse me again. So I'm going to be checking AJ's, I'm going to be checking the spinal accessory. Raise your shoulders. So the equally bilateral, he was able to go against my resistance. I'm going to assess AJ's neck range of motion. So I'm going to have you go front to back, perfect, side to side, then chin to shoulder, perfect. So that does indicate that the spinal accessory nerve is intact as well. The last but not least, is cranial nerve 12, which is the hypoglossal nerve. For this one, I'm going to have AJ stick out his tongue. It is midline. I'm going to have AJ move it from left to right, up and down. So everything checks out there, so cranial nerve 12 is intact as well. Yeah. So continuing on, we're going to do, I'm going to assess AJ's ear, but before we get to that point, I'm going to have him perform the Romberg's test. This is just testing his balance overall. To do this, I'm going to have AJ stand up. I'm going to have him close his eyes, and I'm going to apply probably light pressure and see if he tips over. So it looks like AJ has fairly decent balance, so that's going to be a thing that might be a negative test if I'm correct.
How positive would probably be, I have an issue.
Yeah.
Like I fell over.
Correct. So next, I'm going to assess AJ's ear. I'm going to be looking at the external part of the ear. So we have the helix right here that is intact. Looks like we have anti-helix, the tragus, the antitragus, and then the lobule, I believe is how you pronounce it. So the external ear is intact. We're going to continue on to the internal ear. So the four major landmarks I'm looking for is the pars flaccida, the umbo, the pars tensa, and the cone of light. So for AJ, he's an adult. I'm going to pull the pinna up and back. If he was a child, I'd be pulling down and back. So we're going to pull up and back. Kind of get in here, get past all the wax.
Ears are self-cleaning.
There we go. So I'm able to visualize the tympanic membrane is intact. I am able to see the pars flaccida. Am I hurting you at all?
No, you're fine.
Okay. Let's see here. The umbo I am able to see. I can see he does have a prominent, it looks like the short process of the malleus. I can barely visualize the other two, the cone of light and the, I'm trying to pop it. I can see, I was able to see the pars tinea as well. So, pause it. So next we're going to be moving on to the lymphatic system. Doing assessing the lymphatic system for AJ. I'm going to be assessing the lymph nodes, see if there's anything enlarged, any abnormalities that I can feel for. So let's get into it. I'm going to set this down, don't need that anymore. So there are 12 lymph nodes I'm going to be assessing. I probably will be referring to my notes as I am kind of familiar in the placement of them, but not very familiar. So bear with me. So the first one I am going to be assessing is the preocular, which is going to lie behind the jaw here. So I'll have you turn actually. So right in this area, I don't feel anything enlarged, and we'll move on to the postocular, which is postocular, which is kind of a little bit further back. I feel. So I don't feel anything either. Continuing on, we're going to do the occipital. So my primary care physician told me that there's like an occipital chain that runs down like the hairline of the neck, so we're kind of just going to feel the back of the neck here along the hairline.
Tickles.
Sorry. But from palpate, I don't feel anything enlarged or anything like that, so we're going to continue on. The submental is going to lie below the chin in the middle part, so like the soft palate part. AJ has some thick, coarse hair. So nothing I feel there. Then we're going to do the submandibular, which is kind of a little bit wider at the base of the jaw. I don't feel anything there either. So next we have the, let's see here, the anterior cervical chain, which just kind of lies along the carotid artery of the neck, so without occluding the carotid. You don't want AJ to pass out.
Or do
So I didn't feel anything there. Next we're going to feel the tonsillar. Don't feel anything there either. So next, the next two we have post cervical.
Post cervical.
Behind the neck.
That's what I have found.
So post cervical lymph node is going to lie behind the neck, kind of the base of the occipital chain. Don't feel anything there either. The last two I'm going to feel for are the supraclavicular. So we're going to feel for AJ's clavicles here. Don't feel anything. Then we're going to do the infraclavicular below the clavicle. I don't feel anything there either. So all in all lymph nodes that I tried to palpate for, I was unable to feel. So I believe that's concurrent with there's no active infection going on in AJ, so we're good there. Referring back to, I did forget to assess his thyroid and trachea, so I'm going to do that real quick. After that, I'm going to auscultate his carotid artery for bruit, so let's continue on. I'm going to have you turn sideways here, kind of like that. So I'm going to use my hands, reach in front of AJ, feeling for his thyroid. I think I feel about right here. Yep, feels like it's intact. place my hands on his trachea. I'm going to have AJ swallow. Trachea is midline, no deviation there, so that's good. I'm going to grab my stethoscope. I'm going to auscultate for a bruit along his carotid artery. So I do not hear a bruit for his carotid artery. So that is going to conclude my head to neck assessment of AJ. Thank you for participating. I greatly appreciate it.